Hello, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $2 million mark and beyond. Today I'm going to try a little bit different. I feel like the last couple of episodes I was just kind of doing a rant. I'm going to take two patient cases and go through them in a little bit more depth with you. And I just want to see if you maybe like this version a little bit more. One's going to be kind of a good thing that I did, and another thing would be a bad thing I did. Just so we can all learn together. So first one, there was a 71-year-old female. So she came in, she had plantar fasciitis, and we decided to do, so normally I did a night splint for her, foam rolling, morning stretch, the first visit. She got new shoes, things like that. And she came back after 3 weeks, wasn't better. I did an ultrasound. On the ultrasound, it showed that the right side of the fascia was a lot thicker. And so based on that, what I do is I did Shockwave. So she did 6 sessions of Shockwave. And then after the 6th session, the way I do it is I have this little, congratulations, you finished Shockwave. So the last Shockwave, I do an office visit with that one. And then she was here for the 6-week follow-up. Now, when patients come back, a lot of it is expectations. And I think this is, if one thing I've kind of learned over time, it's with Shockwave, there has to be good expectations set for patients. And you kind of under-promise and over-deliver. Meaning, I say at about 6 weeks out, I'm thinking you're going to be 50 to 60% better. You're going to have more good days than bad days. And it's going to slightly get better. And if you're there, then that is a success. And so when she came back in, she was feeling better, but she said, "Hey doc, I'm not feeling like 100% better." And I said, that's normal. You tend not to feel 100% better. And what I did is I said, and what I tend to tell patients is I say, after we do the 6 sessions of Shockwave, sometimes I'll do a touch-up. And I kind of call it touch-up. I heard this analogy before. It was kind of like you have to touch up paint on a wall. Sometimes we have to do a touch-up. Now, I want to be clear. I want to value my time, and I don't want to give everything away. But there's a certain inherent value in the Shockwave itself, because she just got done paying $250 for each session. And now she's here, and I tell her, well, as a courtesy, I'm going to do another Shockwave for you today because you're not, 100% better. I think you'll get there. We have to give it more time. I think we should do a touch-up. And so I say, and so I'm not going to charge you, so you're actually going to save $250. So in their mind, they're anchored at, okay, I just saved $250. This guy is a nice doctor. And then I say to them, what the best thing for you to do long term is going to help this not come back would be to make you a custom orthotic. And so this patient, I did scan her for an orthotic, and then she paid $600 for the orthotics. But in her mind, she had saved $250 because I didn't charge her for the Shockwave. Another thing that I do is when I'm doing these touch-up Shockwaves, I'm only using one machine. So I just used that day it was just the Softwave. And I didn't do both, just to save me time, because a lot of times I'm not setting aside a lot of time. I'm not doing the radial and the focused or broad focused machine. Okay, so and so then she's going to come back. I make a follow up. I double the time, so the first follow up is at 6 weeks, and the second follow up is at 12 weeks. Now her orthotics will be in about 3 weeks, and then there's like a 6-week follow up after that. So I'm going to have that as my follow up. I'm sure she's going to be fine, and she's going to continue to get better. So that was the first patient. And another issue that sometimes can happen, which I find one of the once again, setting expectations, is patients that get orthotics and they say, hey, I have plantar fasciitis on the right side, but that orthotic, the right orthotic, doesn't feel as good as the left orthotic. And then I always tell them, well, what side do you have the foot pain on? Well, I have it on the right side. And I tend to be very clear with patients that until the inflammation goes down, the orthotic isn't going to feel as good on the symptomatic side. And this is something I say over and over again, that yes, once the foot pain goes away, your orthotic is gonna feel better. Okay, so that was kind of thing one for the day. Thing two, this was an interesting case, and it may be. And I want to kind of show where I kind of didn't make a mistake, but I wasn't as decisive. So I had a patient. He was an 81-year-old man. he has pain to the posterior tibial tendon. He has a very severe posterior tibial tendon dysfunction and was developing pain in that tendon region and didn't have orthotics. Now, when he came in, I was doing Shockwave for him, and he was on, I don't know, number 2 or something like that. And I was out for a week, and my partner saw him. And when my partner saw him, he scanned him for orthotics. And so if you, and I think it's because my partner is much more decisive in terms of flat foot, and I personally, I prejudged him thinking, oh, I'm going to do Shockwave, that like he's spending $1,500, I'm going to do orthotics later on. But really, with that type of a dysfunction and foot deformity, an orthotic is really the best thing for him, in conjunction with the Shockwave and possibly even an AFO, but he wasn't really willing to wear an AFO. So I guess the learning experience for me is I probably should have done the Shockwave and then maybe even scanned him earlier for the orthotics. And I was kind of worried about having him pay, things like this. But when he did get the orthotics and he's wearing them now, he's feeling much better because it's supporting the tissue a lot more. So kind of poo-poo on me for not doing the orthotics. Good for my partner that does it. And I think that happens a lot of times when you're in a practice with multiple providers. I remember going to like an AAPPM meeting, and there's one doctor specifically that does a lot of AFOs. He does a lot of the balance braces. And so whenever he was seeing one of the other doctor's patients, like these patients were going to be getting compression garments and AFOs and everything else like that. And a lot of it is what you keep your eyes open for, and then how decisive or confident you are in offering the treatment. And I think this is a big aspect in terms of how we explain things to patients. There are certain providers that are much more confident, maybe just based on years of experience of doing orthotics or making those connections with foot type and how much they're going to benefit from the orthotics. Or any other type of treatment that you're so confident that it's going to work. A lot of times our patients, they absorb our confidence about the treatment. Okay, so if you're not confident or if you're wishy-washy, they're not going to take your recommendations. They're going to feel like you're trying to sell them versus doing what's the best for them. And this is something that's taken me a while. So I'd like anyone that's listening, anyone that's new, to kind of take this on. And you can't just like fake it until you make it. That doesn't really work. You really have to have confidence in the treatment. And unfortunately, to get better, you have to be bad in the beginning. And so that's where, just going back to, in terms of Shockwave or any of these treatments, a lot of times in the beginning, to build my confidence, I had to do it either for free, because I wasn't good at having them pay, or I did it at a decreased amount. So in the beginning, I did, for example, ultrasound. I was either doing it for free or for whatever, $50 or something like that. Same thing with Shockwave. I was doing it for less for a period of time so I can get my confidence in the technology, so that now I have a plan. So like, and a lot of it is, like I said, the patient expectations. One of the things I still struggle with, and this is, I always like to explain kind of what we're working on, is we use forward motion in terms of orthotics. I think it's a excellent orthotic. But I find forward motion has a lot more modifications and adjustments than Northwest, meaning the arch tends to hurt more, and I have to send them back a lot more than I ever did with Northwest. Now, they are maybe $30 cheaper, but there's a lot more, like I said, adjustments. And so I feel much more confident, or like my partner, he does more Northwest. And so like for a really, they have a nice posterior tibial tendon dysfunction orthotic that worked really well for this patient, that he, and there's less of a risk of them not feeling good. I think one of the concerns, depending on your orthotics, is if you're having a lot of returns or a lot of uncomfortable orthotics, it makes it a challenge. And so this is something that I've been struggling with forward motion because of the arch. And I don't know if it's because I tend to always do like the regular arch. I don't usually do a high arch unless it's a cavus foot. But I'm finding the materials are a little bit different versus like the carbon fiber one with Northwest. So I'm just kind of saying something that I'm struggling with, and I'm almost thinking about doing more of that carbon fiber because I tended to have a lot less returns. But it also could be just that I'm doing many more orthotics, and I just have to get better. Right? I have to get better at the prescribing and details of the orthotic. So it might not be in nature. It may just be I'm doing more of difficult patients. But what I don't like is when they pick them up, because I don't see them when they pick them up. And then I would do a 6-week follow-up, but many times they come in and they're just frustrated because they're not comfortable. So I'm trying to be much more clear with patients. Hey, if these aren't comfortable, don't wait 6 weeks to tell me that. We need to kind of make an adjustment earlier, or I'm thinking about switching to another lab. Okay, so hope you guys found that beneficial. This was a simpler one. I'm not going to go through the rest of the day. If you like this new format, let me know. I'm going to kind of try to pick a couple from the day and go a little bit more detailed. Once again, please subscribe to this podcast wherever you're at. If you're on the podcast or on YouTube, share it with friends. I would really like to get this in the hands of more people. And then I do have some free resources on Podiatry Practice Mastery. If you want to learn more, I think they would be beneficial to your practice. Okay, have a great one. Thanks.